Welcome to our video on international agreements that tackle both climate change and global health. Climate change is one of the biggest threats to public health in the 21st century, and world leaders are recognizing that addressing this crisis requires global collaboration. Today, we'll explore how international agreements are shaping the future of health and climate resilience. Climate change affects health in profound ways, worsening air quality, increasing heat-related illnesses, and accelerating the spread of diseases like malaria and dengue. Rising temperatures and extreme weather events also disrupt food and water security, impacting millions. These global challenges demand a coordinated global response. The Paris Agreement, signed in 2015, marked a turning point in the global effort to address climate change. While its primary focus is on limiting global warming to well below 2 degrees Celsius, the agreement also acknowledges the significant impacts of climate change on public health. Countries committed to reducing greenhouse gas emissions to mitigate these effects and protect future generations. The World Health Organization, WHO, has been a vocal advocate for integrating health into climate action. In 2015, the WHO released a report linking climate change to major health risks and called for stronger international efforts to protect the most vulnerable populations. The health argument for climate action is clear: by reducing emissions, we also reduce disease burden and improve overall well-being. The annual COP summits have become critical platforms for discussing the intersection of climate change and health. Health advocates and professionals, through initiatives like the Global Climate and Health Alliance, are pushing for climate policies that directly address health impacts. These conferences have elevated the role of health in international climate negotiations. In 2015, the United Nations adopted the 2030 Agenda for Sustainable Development, including 17 Sustainable Development Goals, SDGs. Goal 3 focuses on good health and well-being, while Goal 13 calls for urgent action to combat climate change. Together, these goals reinforce the need for integrated strategies that address both the climate crisis and global health challenges. The Kigali Amendment to the Montreal Protocol, signed in 2016, is a global agreement to phase down the use of hydrofluorocarbons, HFCs, potent greenhouse gases used in refrigeration and air conditioning. This amendment is expected to prevent up to 0.5 degrees Celsius of global warming by 2100, while also improving air quality and reducing related health risks. While significant progress has been made, there's much more to be done. Stronger international cooperation is needed to address the dual threats of climate change and public health. By enhancing climate policies, investing in green technologies, and supporting vulnerable populations, we can create a healthier and more resilient world for all. We all have a role to play in building a sustainable future where both our planet and our health thrive. Stay informed, support climate action, and advocate for stronger international agreements. Together, we can make a difference. Subscribe to learn more about the intersection of climate policy and health.